Hello everyone. I'll be presenting about a research paper for big data analytics. Uh, and the research paper is as titled The Role of Big Data Analytics in Improving the Quality of Healthcare. It's basically in an Italian context and mediating the risk management. And the authors are, as mentioned, and they are from the university based in Italy. So moving on to the introduction of the paper, it's basically about the healthcare systems in Italy and how they are adopting the digital technologies and generating big data that can be leveraged through analytics to improve the decision making and the service quality. And the big data analytics basically refers to a technology where the large data is being processed, manipulated, and better organized for decision making and optimizing for best resource utilizations and decision making. So, the risk management here involves identifying and mitigating the risks in the healthcare sector to ensure the patient's safety and the service efficiency. So, the objective of this paper is to explore the big data analytics, which enable the risk management practices and improve the quality of healthcare services in Italy using data from the healthcare professionals. So, the literature review of the paper is that the big data analytics, as we know, has been increasingly applied in the healthcare sectors to support the decision making and the predictive analytics and operational optimizations. So, it that is how the basic structure of the paper is, and it's a review. And the big data analytics, as shown, is enabling the patients and is giving a scope for improvement and outcomes by enabling more personalized treatments and efficient use of resources. And there is also risk management in healthcare which is required. So the risk management in healthcare focuses on identifying the potential adverse events and mitigating risks in the patient's safety. And the previous studies emphasizes the role of risk management in improving the service quality and reducing the healthcare costs through prevention and monitoring. So there is also a limited empirical research investigation that there is a relationship between the BDA and the risk management and how the risk management mediates the impact of BDA on the healthcare service quality. So, moving on to the methodology in the paper, the study is grounded to organization information processing theory, which focuses on how the organization manages the information, reduce the uncertainty, and improve the decision making. And the survey is that the data was collected from 204 healthcare sectors, professionals in Italy through the structured surveys. And analysis model partially least square structures equation modeling was used to analyze the relationship between the BDA risk management and the quality of healthcare service. And independent variables of BDA usage and the risk management practices and quality of healthcare devices were also being analyzed. So, the big data analytics in healthcare, as we know, big data analytics is a process of acquiring, storing, analyzing a large amount of data in the health care sector, especially which is used to extract meaningful insights from those data. And the applications of it could be in tailoring the treatment plans based on the patient's data and medical history, or like using the data to predict the future trends such as diseases or outbreaks in the patient's health and deterioration of their health. And also like operational efficiency, which means improving the hospital operations by optimizing staffing, reducing patients wait times, and also streamlining the resource allocation. So the implementation issues include there's challenges to that, which means the data privacy is at a concern, and the lack of system interoperability and high costs are certain risks that come with it. So, healthcare risk management practices, it refers to a systematic approach of identifying, analyzing, and mitigating the risks that could negatively affect the patient care and hospital operations. And identifying the key identification means that the identifying the potential adverse events such as medical errors or equipment failures is very essential, and tracking identifying risks over time and making adjustments to prevent incidents is also essential, and preventing measures, implementing strategies to reduce the risks, and also infection control and resource optimization is essential as well. And the risk management plays a crucial role in maintaining the healthcare services quality and the patient safety by minimizing the likelihood and the impact of the adverse events. And the advantages of big data analytics in the healthcare sector is the improved decision making, data driven insights, enhanced clinical and administrative decision making, and big data analytics allow for more precise patient care based on the individual data, and uh, personalized treatment based on which allows precise treatment based on the individual data of the patient. And also the hospitals can optimize the resource use, reduce the waste, and streamline the operations, and predicting health outcomes for proactive innovations is also a pro. Moving on to the cons of the big data analytics in healthcare, the implementate the big BDA analytics or the big data analytics infrastructure is very expensive, which requires a substantial investment of technology and training, and managing large amount of sensitive healthcare data, which includes privacy risks and security issues under GDPR, and interoperability issues, difficulty in integrating different healthcare systems leading to data silos and reduced efficiency, lack of skilled personnel and technological infrastructure in many healthcare facilities hinders BDA implementation. And scope for improvement is that more efforts are needed to standardize healthcare data and ensure interoperability across different systems, and develop stronger data protection protocol and ensure compliance with privacy laws like GDPR, and healthcare staff require training in BDA tools and techniques to fully utilize its potential, and developing cost effective BDA solutions, and encourage public private partnerships to fund infrastructure and upgrades. Uh, Moving on to the conclusion is that BDA plays a vital role in improving the healthcare quality and supporting the risk management policies and practices. Risk management, particularly the identification and monitoring, mediates the relationship between the big data analytics and the quality of the health services. So, effective use of BDA reduces the uncertainty and enhances the decision making, and leading to a better healthcare outcome and operational efficiency. And the future scope could be exploring and integrating AI with machine learning with BDA, or even more advanced predictive analytics for risk management capabilities. Thank you.